टेक्निकल एक्सीलेंस के लिए नहीं है। हम जानते हैं हमारे पास बहुत महान 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 डॉक्टर हैं, लेकिन कहा गया जो बहुत महान थे वो चले गए। एक खड़े हो जाइए अपने स्थान पर प्लीज, मैं थोड़ी बचकानी हरकत कर रहा हूँ, जगह पे खड़े हो जाइए और इस ताली के बैठ के बाद वो जितना गरीबाजी को सिखा दी, ऐसे आगे लीजिए। 1 2 3 4 1 2 3 4 1 2 3 4। ऐसे मत समझना ये ठंड बढ़ाने के लिए है, इसका कुछ मतलब भी है। इस बीच हमारे एमपी शर्मा जी पहुंच चुके हैं, स्टेट प्रेसिडेंट। एक का मतलब था कि जैसे तैसे मेडिकल कॉलेज में एडमिशन हो जाए, लाइफ सेट। उसके बाद एमबीबीएस में ट्राई किया, एमडी में किया, बस एक नौकरी मिल जाए, एक छोकरी मिल जाए, लाइफ सेट। लाइफ भी सेट हो गई, थोड़ी तनख्वाह भी आने लग गई। फिर आदमी की डॉक्टर की इच्छा हुई और मेरा इतना नाम होना चाहिए, इतनी शोहरत होनी चाहिए, इतना दूर दूर तक होना चाहिए। तभी तक कोरोना आ गया, प्यारे मित्रों, भाइयों, सीनियरों, बैठिए। ये तालीम नहीं बदलनी चाहिए। सेलिब्रेट लाइफ एवरी डे और स्वयं के लिए आधा मिनट तक नॉन स्टॉप ताली बजाइए। और मैं सेक्रेटरी साहब को सूचना दे रहे हैं,
ऑल टीवी स्टार्ट हो चुका है साइंटिफिक सेशन के साथ। जो ऑल टीवी में साइंटिफिक सेशन करना चाहे प्लीज वहां जा सकते हैं। थैंक यू।
महात्मा गांधी कॉलेज के बहुत ही नामचीन, बहुत ही प्रसन्न डॉक्टर साहब यहाँ उपस्थित हैं। उनसे मैंने वायदा किया था प्री लंच, इनको कहीं जाना है तो थोड़ी तब्दील की इजाजत चाहता हूँ। डॉक्टर हेमंत मल्होत्रा जी हमारे बीच में हैं, कैंसर प्रिवेंशन एंड अर्ली
डायग्नोसिस। डॉक्टर हेमंत मल्होत्रा इज कैंसर प्रिवेंशन एंड अर्ली डायग्नोसिस, व्हाट इज न्यू।
सर आप ये मान सिंहासन लेंगे कि?
वेलकम डॉक्टर हेमंत मल्होत्रा। डॉक्टर अनिता प्लीज कम।
आप सब लोगों को मेरा नमस्कार। मेरा नाम हेमंत मल्होत्रा है। मैं एसएमएस मेडिकल कॉलेज में एमबीबीएस एमडी करने के बाद एसएमएस में था 30 इयर्स के लिए फैकल्टी, और वहाँ पे मेडिकल ऑन्कोलॉजी का विभाग मैंने सेट किया। बहुत सारे मेरे दोस्त मित्र स्टूडेंट्स ऑडियंस में हैं, आप सबको मिलकर देख के बहुत खुशी हुई। अभी आधार से थोड़ा सा साइंस की तरफ फर्स्ट 2 सेशंस में मुझे बहुत आनंद आया। Contact details of all the previous speakers and people call me to our institution. तो 2018 पिछले 8 साल से मैं महात्मा गांधी मेडिकल कॉलेज में हूँ। I am the director of oncology there. I am the head of medical oncology. When I was asked the topic, what would you like to say? I was very tempted to say, kind of choose a topic like advances in oncology, immunotherapy, targeted therapy. But I chose to speak today to you on cancer prevention and cancer screening. This is not only relevant to you, but it is also relevant to your patient. So I hope in the next 10-15 जितना भी टाइम उसमें देंगे, जब ये बोलेंगे मैं उसी वक्त बात करूँगा। तो एक बार स्लाइड लग जाए तो मैं शुरू करूँगा। सबसे पहले तो मैं I want to convince you that we are on the threshold of a cancer tsunami. अभी मुझे बताइए शो हैंड्स प्लीज कि आपके फैमिली में कितने लोगों के फैमिली में क्लोज फैमिली में किसी न किसी को कैंसर है। So my mother died of a brain tumor, and I think this is going to happen to every family, not only your family, my family, but your patient's family also. And we really seriously need to think about how can we prevent this क्या अपने को लाइफस्टाइल चेंज करना है, क्या अपने कमिंग जनरेशन का लाइफस्टाइल चेंज करना है, जिससे अपन ये कैंसर का इंसिडेंस थोड़ा सा लगाम लगा सकते हैं। अभी तक जो यंग लोगों का रुझान हो रहा है टूवर्ड्स कोका कोला, पेप्सी कोला, टूवर्ड्स बर्गर्स एंड पिज्जास, आप इमेजिन नहीं कर सकते इससे कितना नुकसान होने वाला है। I know it's a tough job. I have two boys. I mean, I can't convince them myself in my own family that this is a healthy lifestyle and this is an unhealthy lifestyle. And today, believe me, 50% of cancers are lifestyle diseases. आप लोगों को ये तो मालूम है, डायबिटीज, हार्ट अटैक, ये सब लाइफस्टाइल डिजीजेस हैं, बट कैंसर 50% इज प्रिवेंटेबल। तो वो सब कुछ बात करेंगे। अर्ली डायग्नोसिस कैसे करना है, आपके लिए भी रेलेवेंट है, मेरे लिए भी रेलेवेंट है, ऑफ कोर्स अपने पेशेंट्स के लिए रेलेवेंट है। स्क्रीनिंग कैसे करनी है। So very grateful to the organizers of this meeting for inviting me here, and pleasure to be here and talk to you. I bring you greetings from the Mahatma Gandhi Medical College Hospital in Jaipur. And this is our Shri Ram Cancer Center. We have 200 plus beds for cancer patients and comprehensive treatment facilities. Don't have to, kind of brag about that, but we are one of the best cancer centers in the state of Rajasthan. So we talk today about this disease, which is fortunately or unfortunately my expertise, the emperor of all maladies and the king of all terrors. So here for us a little bit of points which we will cover today. So we are past the era of communicable diseases and we are now moving into the era of non-communicable diseases. Non-communicable diseases means heart disease, diabetes, strokes, kidney disease and malignancy. So आप लोगों को सबको, whether you want it or you don't want it, you will have to develop expertise to know about, to deal with non-communicable diseases. पिछले एक डिकेड, 2 डिकेड, 3 डिकेड में अपन ने फोकस किया कम्युनिकेबल डिजीजेस को, मलेरिया, वायरल फीवर्स, डेंगू, कोविड, but now we will have to think of, know about non-communicable diseases. And we are on the threshold of an epidemic, we are on the threshold of a cancer tsunami. And why do I say that? We are going to have a 500% increase in the incidence of malignancy in our country in the next 10 years. And why is it going to happen? Primarily because of aging, because malignancy is a disease of old people, and also because we have not been able to stop the use of tobacco. So मैं सिर्फ एक ही बार आपको कन्वे करूंगा ये कि each one of you has to make an effort कि गवर्नमेंट लेवल पे, लीगल लेवल पे, पेशेंट लेवल पे, ऑर्गेनाइजेशन लेवल पे अपने सबको, each one of us has to make an attempt कि ये जो टबैको का मेनेस है ये अपनी सोसाइटी से कम अपने स्टेट से तो निकाला जाए। So this is the incidence and this is Indian data, this is not foreign data. Age-adjusted cancer rates in men and women, little more in females. This means that per lakh population, 150 females and 120 males will have cancer. Now if you extrapolate this to our country, so 1 out of 7 men and 1 out of 6 women. अभी अपने हॉल में करीब 100 जने हैं मेरे ख्याल, तो इन 100 जनों में से 10 जनों को बाय द टाइम दे रीच एज 72 of malignancy हुएगी। So that is why it is important for you to listen to what I am talking to you and try to implement that. कि कैसे early diagnosis हुए, what are the symptoms and what are the screening tests which each one of you should get done.
Then you again put in a dual lobe, you do this on the other side as well. So both these two halves of the liver are joined inside the recipient or the patient and made as a full or a complete liver. So both these livers are implanted and the anastomosis is done. Once that is completed, you will get a full liver specifically done for those individuals who are much more obese and one part of the liver is not sufficient for them. So we are fortunate that this was very widely covered in the social media as well about the long surgery of dual long liver transplantation. Again, we were fortunate that media has been kind to us to cover all the major transplants, be it the first pediatric transplant in the state of Rajasthan, or be it first liver transplant in children, smaller children. As you can see, this is a very young girl of 7 months old, completely yellow, fully jaundiced, and this is how they recover once the transplant has been done. We also now have crossed the ABO incompatibility. That's a blood group. Usually we try to make and do liver transplants in blood group compatibility, but we are able to overcome that with a mismatched blood group as well with various techniques. So we also do ABO incompatible or a blood group mismatched transplants as well at Mahatma Gandhi University Hospital. So sometimes we get patients who come to us with acute liver failure. They are already on ventilator, intubated, and once the transplant has been offered at the right time, this is how they recover back from a good transplant procedure, which is timely done. Now at Mahatma Gandhi, it is not only the numbers we are trying to follow, we are also very keen to look at the outcomes of these patients. We have got a good survival of nearly 90% in most of our patients, which is much more than the worldwide transplant. Again, at Mahatma Gandhi Hospital, our founder, chairperson, Professor M.S. Swarnka sir, is very keen that we make this surgery very, very affordable. And that is why at the institute, if you look at the cost in the Western world, a liver transplant will cost you anywhere between 2 to 3 crores. But at our own institute, as you can see, Mahatma Gandhi is trying to reduce the cost at between 15 to 16 lakhs, which is very much subsidized. And if you look at any other center, no other center in this country is able to do transplant at this cost, including government center. It is at the same price is not what we are offering at Mahatma Gandhi Hospital. Again, Rajasthan has got various schemes in the country, and 70% of our patients who are under the other scheme are now virtually making cashless for the patient, so they do not pay anything out of pocket. Again, only clinical aspect is not what we are happy with. So at Mahatma Gandhi Hospital, since we are a teaching institute, we are the third institute in the country which offers an MCH, HPV surgery and liver transplantation course, and we are the second highest in terms of doing number of liver transplantation in a medical college in India. And if you take out Delhi NCR, then probably we are one of the major centers in the north, barring Delhi NCR in number of doing liver transplantations. Most of our faculty have been on various boards and the societies, and that's our team. That's our whole team which is responsible. Liver transplant is definitely a teamwork, and it is OT nursing team and the team of Center for Digestive Sciences where we are able to offer such niche surgical treatment in the state of Rajasthan. So before I go, there are some tips I want to say for a good or a healthy liver. Maintain a healthy diet, limit alcohol consumption, stay well hydrated, try and exercise regularly, avoid smoking and illicit drug usage. Whenever possible, get vaccinated. We now have vaccines for hepatitis B, hepatitis A, and there will be a new vaccine being launched for hepatitis E virus as well. And obviously, safe sexual practices is going to help you protect your liver. That is all I would like to say. Thank you very much.
Thank you so much, Dr. Naresh Mehta sir.
कमाल इतनी सरल बात इतने और सरल तरीके से बता दी एक मौलवी थे वो बाद में बाद में बताऊंगा सर बीच में जी
Sir, please kindly accept that token of appreciation. उसके लिए मैं मंच पर आमंत्रित करूंगी सर डॉक्टर एमपी शर्मा सर, हमारे स्टेट प्रेसिडेंट, डॉक्टर राजेंद्र सिंह,
राजस्थान आईएमए के प्रदेश अध्यक्ष डॉक्टर एमपी शर्मा साहब,
उनके साथ डॉक्टर राजेंद्र सिंह सर, हमारे पास प्रेसिडेंट आईएमए भिवाड़ी, and Dr. Vipula Madam, हमारी women coordinator IMA Diwali. Kindly please come up.
हमारे नेशनल वाइस प्रेसिडेंट साहब का भी मन कर गया, रोक के मारूंगा कैंसर को। थैंक यू सर, स्टिल लैस सर विप्ला जी और आने जल्दी आ जाइए। जी जी आइए प्लीज, आइए आइए। बहुत ही शानदार बने सर, और बहुत ही शानदार आपका लीवर ट्रांसप्लांट महात्मा गांधी।
सबने तो ऐसे बताया बस ये लो और जोड़ दो, बट so simple. Thanks for coming here. All the best. Thanks.
Thank you so much, sir.
एक मुल्ला बहुत समझाता था किसी को, शराब मत पिया करो, शराब मत पिया करो, शराब से लीवर खराब हो जाता है। तो जिससे कहते थे उसने कहा, एक मुल्ला एक बात सुन, दम है तेरी बात में तो मस्जिद हिला के दिखा, दम है तेरी बात में तो मस्जिद हिला के दिखा, नहीं तो 2 घूंट ले और हिलती भी देख। सर का लेक्चर अपनी जगह है, लेकिन प्रिवेंशन इज बेटर देन क्योर।
अब हम स्टेज पर आमंत्रित करेंगे डॉक्टर BS शर्मा फ्रॉम MGM जयपुर। Dr. BS Sharma is a renowned neurosurgeon and director of neurosciences, trained at PGI Chandigarh with advanced training in the UK and Germany. A former professor and HOD at AIMS New Delhi, he specializes in minimally invasive and microendoscopic brain and spine surgery and is internationally recognized for his academic and leadership contributions.
तो एक बार ताली बजा के डॉक्टर साहब का खैर मकदम करें। फ्री लंच सेशन है, हमारे पास 2 घंटा और है। BS शर्मा साहब का राजस्थान न्यूरो सेंटर में बहुत बहुत नाम है। सर आप कल ही आ गए थे, तीनों चिकित्सक IMA के लिए इतना उन्होंने सम्मेलन दिया, इसलिए मैं आपसे कहूंगा कि हम केवल ताली बजा सकते हैं आपके सम्मान में। तो कावड़ा आने दे बिल्कुल।
Yes, Dr. Sharma. At the outset, I wish to thank the group and organizers for the invitation, giving an opportunity to correct August gathering.
अभी सर ने आके पेंडा से ड्राइव
Today's is advanced neurosurgeon. You know, I am basically a neurosurgeon. So, in the last 2 decades, there have been tremendous advances in neurosurgery. And I will just show you some small videos. And this is not an advertisement, but this is just to information and just to let you know this kind of surgery is now being done regularly in Mahatma Gandhi.
डॉक्टर BS शर्मा सर एडवांस आ गया सर।
जब तक इनकी स्लाइड सेट होती हैं, मैं आपको सूचित करना चाहता हूं कि हमारे लीगल मैटर्स पर और डॉक्टर्स की हेल्प के लिए हमेशा उपस्थित रहने वाले डॉक्टर सचिन झा हमारे बीच में पहुंचे हैं। AMR यानी एंटी माइक्रोबियल रेजिस्टेंस पर हमारे देश के प्रतिनिधि, IMA के प्रतिनिधि डॉक्टर सैनी साहब हमारे पास पहुंचे हैं। उनके लेक्चर फ्री लंच है। कृपया हम दोनों के बारे में एक बार ताली बजाते हैं।
यस नेक्स्ट क्लिक सर आप क्लिक वहीं पर नहीं कर सकते।
Yeah, in last 2 decades, there have been tremendous advances and in diagnosis, and this is because of availability of equipment in operation theaters, surgical approaches and techniques, and it all have changed the scenario completely and have made neurosurgery very safe and quick. Now, OT equipment in operation theater, especially the neuro navigation or image guidance and neuro monitoring,
which can be seen during operation, and it prevents of neurological death. Now, especially the intraoperative ultrasound or CT scan, which is useful in cranial surgery to confirm the total excision of tumor or hematoma. Similarly, the availability of O-arm, which takes X-ray in all three axes, is very useful in safe and accurate and quick placement of the screws in the spine. Now, two important things, magnification and illumination, which is provided by surgical microscope and the endoscope. And high-end surgical microscopes are very useful during surgery. About the approaches are conventional approach, complex skull-based approaches, and the minimally invasive approaches. Now, this is just an example. This I operated, say, about 20 years back. This is a suprasellar epidermoid, and it's a 5-frontal craniotomy is being done. And this is the parts which is being cut and divided. Now you see the base of the brain, and the brain is being dissected from the olfactory tracts. Now you see that this all white epidermoid which is being removed. And now you see this is the pituitary stalk, and this cyst was adherent to all the vessels and the cranial nerve, and the wall is being dissected from the optic nerve. And now you see it's being dissected from the hypothalamus. Now you see this is the hypothalamus is being separated, and soon you will see that this hypothalamus is continuous with pituitary stalk. And everything was preserved. So this is what is the beauty of microscope, that all, even the small perforators, if they are regulated, patient will get neurological. Now you clearly see the pituitary stalk, hypothalamus, visceral artery, and all its branches. Now this is one bypass which was done from external carotid to middle cerebral artery in the case of giant aneurysm. Radial artery was harvested, and this is the middle cerebral artery branch which is being dissected. And now this is the radial artery and is being anastomosed in the neck in the external carotid. And for this is the end is being prepared, it is end to side anastomosis. And now this is the aortic punch. With this opening is being made in the external carotid artery. And this is about 6O needle. And this is the anastomosis is being done in the neck. Whereas in the cranium, we need 10O needle, which cannot be seen by naked eye. So it has to be done with microscope. And anastomosis under microscope really needs very good, high quality skills for anastomosis. And this anybody can do who has practiced a lot in laboratories. And this is a clip that is being applied there to prevent the bleeding. And now this is the being anastomosed and the knots are being put. Now it's the other side. This neck anastomosis is complete. And now we come to the cranial part. And this is the amount of blood you get once that, because you are going to occlude the internal carotid artery, which contains a giant aneurysm. So this has to provide sufficient quantity of blood. And now this is the middle cerebral artery, and here the anastomosis is being done with it. And again, we use the gential violet to visualize the ends of the artery, and this is how the 10-0 anastomosis is done. This is the front side of anastomosis, which is being done. And it is either with microscope or with endoscope. For neurosurgery, without microscope or endoscope is not neurosurgery, it's general surgery. So now if we anastomose this, we tie these vessels. And it is the other end, the back part is being anastomosed. And this is the back part of the and I have many videos, so if you are not interested, we can stop at any stage. But I think it's good to see that. And now finally, this is the radial artery, which is pulsating and providing blood to the brain. Now this is another, a giant, large meningeal. You can see it's so bloody and it's brilliantly enhancing on contrast. And this is by complex skull-based approach, which I have mentioned. And this is after front orbital diagomatic craniotomy. And this is now the tumor becomes less vascular or almost avascular. And now when removing the tumor, you see this is the middle cerebral artery which is encased by the meningioma. So this is being dissected. And when we dissect this, from this, we will see that the ICA can be seen, which was also encased with this. So what I mean is that in meningioma, which are benign tumors, whenever there is a vessel encasement, the vessel has to be preserved. Because if you coagulate this vessel or reorg, the patient will become healthy. So this is the internal carotid artery you see now. So a tumor on medial side, lateral side, anterior, posterior, so it's completely encased. So now this tumor is being dissected from the internal carotid and middle cerebral artery. And like this complete excision of this tumor was done. I think with the need of time, I can just pass it on. And now is the minimally invasive surgery, is keyhole surgery with microscope or endoscope, with channel endoscopy, where the instruments are through the channel in the endoscope, and endolaser surgery through the natural orifice or the loop, or endoport surgery, where a small endoport is made in surgery. Now this is about the keyhole surgery, very small, about 2 centimeter incision just within the eyebrow, in upper part of lateral 2/3 of eyebrow, and about 3 into 2 centimeter bone flap is raised. And this is the advantage of endoscope, that when we operate with microscope, the depth becomes narrow, whereas with endoscope, the depth becomes wider. So it's a reverse funnel shape of radiography. Now this video I am showing because we just saw an epidermoid with major craniotomy. Now this is the epidermoid with keyhole. Same epidermoid being removed with keyhole. Very small craniotomy. And this on lateral side of a carotid artery, the epidermoid is being removed. You can see the pituitary stalk again. And once apparently it was there that almost all epidermoid is removed. So I will take the endoscope now. Now the keyhole endoscope is the basic concept. The figure on the left side is just what we see with the naked eye. In the middle is when we see put a microscope, we see this. And the last image is when you take an endoscope and put it in the window, and this is what we see. So it makes it lot. And now, because with endoscope, you have to aspirate it after putting it over. Now, this is the channel endoscope. Here, instruments are passed through the channel endoscope. And this was removed and then go into the foramen. Now, this is the lateral where you can see the system. Now, what I have done is 6-member event review with far through the endoscope and just make a suction with 20 ml syringe and it just removed into the endoscope. Again, here the cystic surface cyst is in the fourth ventricle. So a simple barrel endoscope, you go through the foramen Monroe, through the aqueduct. Now I'm going in, putting that again tube, same tube, gentle suction, and then gradually we take it from fourth ventricle to third ventricle to foramen Monroe to lateral ventricle and then remove it. So very fascinating endoscope surgery. Now this is one common colloid cyst of the third ventricle, just with barrel and endoscope. This is the colloid cyst we can see. After coagulating the wall, we open and evacuate the contents which are colloid in nature. And this is what just a thick bone needle. And when now it is coagulated all around and part of it is removed. Now in the endolaser surgery, this is a very common pituitary endoscopic surgery for pituitary tumor. There through the endoscope, we open it. And this is being done only through one nostril. So everything endoscope is in one nostril and are also the same nostril. removing this. Now this is the dura of the pituitary fossa. Dura being opened and this had a pituitary apoplexy. So tumor contained dark altered blood. And now once the dura is open and the moment we remove this tumor, this dark altered blood has come. And after this sucking all the tumor, and now you will just see the beauty of endoscope. Now you can take the endoscope inside the cell and see. And now under vision, you look for normal pituitary and you remove the tumor under vision. So all of the tumor is removed under vision and results are excellent. And normal pituitary is present. Oh, yeah, so I think I will stop here. Thank you very much.
Thank you so much, Dr. P. Sharma ji.
ब्यूटी ऑफ एंडोस्कोपी और वो भी न्यूरोलॉजी में। वो केवल डॉक्टर साहब शर्मा साहब जैसे ही लोग कह सकते हैं। सर बहुत बहुत आनंद आया, आपका स्वागत करेंगे।
सर मंच पर आमंत्रित करेंगे डॉक्टर विजय पाल यादव जी का, डॉक्टर के आई मीना जी एंड डॉक्टर जी शर्मा जी।
डॉक्टर विजय पाल यादव जी हमारे IIM अलवर के प्रेसिडेंट सर हैं और के मीना जी हमारे भूतपूर्व निदेशक रहे चिकित्सा सेवाओं के। जी शर्मा जी गंगानगर से आए, हमारे वाइस प्रेसिडेंट हैं IIM राजस्थान। बीच में आ जाइए, आपका बहुत एक शानदार सा फोटो कैप्चर कर लें। हरे कृष्णा। जब ब्रेन की कोई सर्जरी की बात नहीं पड़े तो हमारे विजय पाल जी कहते हैं हरे कृष्णा। लॉन्ग लाइफ सर, आप हमारे टीचर हुआ करते थे, आप सो मोटिवेशनल। थैंक यू सो मच महात्मा गांधी हॉस्पिटल मेडिकल कॉलेज, आपने हमें बहुत कोऑपरेट किया। अब हम बीच में एक छोटा सा एनर्जाइजर कर लेते हैं। कोऑपरेट तो आप लोग कर रहे हैं, कोऑपरेट तो आप लोग कर रहे हैं जो 3 घंटे से पढ़े जा रहे हैं। मैं एक छोटी सी एक्सरसाइज करवा दूं आपको। ऐसे हाथ कर लीजिए, ऐसे हाथ कर लीजिए। अच्छा खड़े हो गए, क्योंकि बैठे बैठे पैर सुन्न हो गए होंगे। हाँ ऐसे हाथ कर लीजिए और गहरा सांस ले जाते हुए ऊपर हाथ करिए और छू दो सितारों को। थोड़े और ऊंचे ले जाइए और ऊंचे और ऊंचे। अब अपने हाथ को पूरा यू टर्न दे लीजिए और कोहनी से मुड़ाते हुए गर्दन के पीछे 3 थपकी दीजिए। 1 2 3। शाबाश शाबाश शाबाश। अगर आप नहीं होते तो हम क्यों बोल रहे होते। थैंक यू।
हम स्टेज पे बुलाएंगे डॉक्टर सचिन झवर जी को। इनका टॉपिक है लीगल इश्यूज इन मेडिकल प्रैक्टिस।
डॉक्टर सचिन जी बहुत ही एक शॉर्ट नोटिस पे आए हैं। हमारे ऑर्गेनाइजिंग सेक्रेटरी के क्लासमेट रहे, बोला थोड़ा कानून का ज्ञान दे दिया करो डॉक्टरों को, बड़े कानून में जल्दी हो। वेलकम करेंगे हमारे अजय, हमारे मुदित, हमारे ऑर्गेनाइजिंग सेक्रेटरी राजमेडिकॉन के और डॉक्टर मुदित जी, द बेस्ट वर्कर ऑफ IIM भिवाड़ी।
Dr. Sachin Thakur is Director of General and Pediatric Surgery at FX Hospitals, Rajmedicon, Jaipur, with over 20 years of experience. A qualified dental and laparoscopic surgeon who specializes in hernia, gallbladder, pediatric, and advanced general surgical procedures. Welcome, Dr. Sachin.
सबसे पहले तो ओम शांति। आई एम श्योर कि हम लोग सब वैसे नहीं होंगे जैसे हम यहाँ आए थे। आई एम 100% श्योर। थैंक यू वेरी मच MP शर्मा सर, ऑर्गेनाइजिंग टीम रूप सिंह जी। अगले 11-12 मिनट के अंदर तो एक छोटी सी स्टोरी से चालू करता हूँ। 2012 के अंदर आई हैव अ सन, वो 10th में था और मैं ऑपरेट कर रहा था तो मेरे पास फोन आया उसका कि उसके टीचर ने, जयपुर के अच्छे स्कूल में था, प्राइवेट स्कूल में, उसके टीचर ने थप्पड़ मार दिया। हाउ मेनी ऑफ यू हैव बीन हिट बाय अ टीचर? गुड, so all of you can